And make sure you've muted. All right, I will share my screen and we'll get started. Oh, can you make sure your microphones are muted, please? Thank you. All right, come on. So you should be able to see my screen. If not, it might just take a minute. If you can't, unmute yourself and give me a holler because I can't see the chat. All right, so to start with, this meeting is just for school and health department staff. It will be recorded, and the recording and the slides will be placed on our website for all to see. But we just like to save the time for our staff for questions and answers. Please mute your microphones. If everyone could please check and make sure you're muted. Thanks. Can you please mute your microphones, everybody? Just take a second to check for me. Thanks. All right, and then just make sure you pass on any information to your school staff and school liaisons so that they have that information. First of all, I know we've all had a difficult couple of weeks. We're all getting lots of communication from our public. So just so you know, we're all aware of how tense things are. I just want to give a few reminders based on questions and things that we're getting. In terms of just general COVID management in the schools, pretty much everything is the same as last year. The only main differences are that regular cleaning does seem to be sufficient. We're not as worried about transfer from objects, so you don't have to do aggressive disinfecting unless you do know that someone who's been positive has been in the area. And then the change in definition of a close contact for students who have been masked is down to interactions less than 3 feet for more than 15 minutes rather than less than 6 feet. It stays the same if the students involved were unmasked, but those are the only two main differences I can think of in how we manage COVID in the schools. So just as a reminder on that, we are in process with the state working on trying to come up with some additional recommendations for some modified quarantine, which are some options for fully masked students to stay in school after an exposure. And we'll talk a little bit more about that. But that would be the only additional change coming. So just the reminders that anyone that you have in the school and in the general public who are considered a close contact to someone with COVID-19, regardless of what kind of exposure it is, whether it's in school or in the home, they don't need to quarantine if it's someone that was considered fully vaccinated at the time of exposure and they do not have any symptoms of COVID at any point. It is recommended that they do get tested 3 to 5 days after their exposure just to make sure that they weren't infected, and that they wear a mask while they're indoors for 14 days after they were exposed. But again, it doesn't matter what kind of exposure they had, if they've been vaccinated, or if they were diagnosed with COVID at some point within the 3 months prior to their exposure, and they've recovered and they continue on without any symptoms. Just some other reminders, the symptoms are the same as last year. The recommendations are the same, other than the distance, as we just mentioned before. Anyone with symptoms of COVID that are new and you can't really explain them from some other illness like allergies or COPD or asthma or different things, should be sent home, shouldn't come back until they have a negative test or until they finish an isolation period. And for employees, this is required by legislative act and public act, so law 339. If they have any one of those symptoms I put in red, or 2 or more of any of the other symptoms listed there. For kids or students, some of the symptoms we highlighted last year were temperature of 104 or higher, sore throat, cough, difficulty breathing, diarrhea, vomiting, or new onset of severe headache, typically with a fever. But those basically suggest that the student is sick with something, and it could be COVID, it could be something else, but any kid with any of those symptoms should go home and not come back until what's wrong with them. And in a case like now where we have COVID around, they should test negative prior to return. But that's why those symptoms have been really highlighted in kids, because, again, any kid with those symptoms could be sick with something contagious. So we did send out a management of COVID-19 cases and close contacts a couple weeks ago, and also a communication guide, which had a lot of templates for letters a couple weeks ago. So I'd refer you to those for more information on all of that. We stopped providing letters to clear people out of isolation and quarantine almost a year ago. So we are not able to do that. We don't have the manpower to do that. We don't always know about the cases to be able to do that. So if you do need clearance letters, for whatever reason, you'll need to get them through the primary care provider or wherever they were tested. I know we were working on providing any person we knew was in quarantine or anyone we knew was in isolation that you might not know about, so someone that was related to a community. We were providing you with that information last year, so if that's beneficial, if that's not already been arranged, or if there's anything else that needs to be arranged, contact your health department point of contact or the CD nurse in your county to figure out how to work around that. So just some general information now. If you've not heard of it, the ABC Science Collaborative is a group that has received research funding, and it's mainly coordinated through the Duke School of Medicine, but they have scientists and physicians from around the country that have been working to look at data from schools. So basically, what have we learned from last year? And they've come up with some good suggestions. The link here is the full report. These are just some infographics from the report. So very similar to what the CDC recommends, because those are evidence-based recommendations as well, but encourage vaccination, adhere to proper masking. They did find that modified quarantine policies were possible when there was appropriate masking taking place within the school setting. Using in-school transmission rates as a metric more than community rates. So not closing schools based on what's happening in the community, which I think that's really what we looked at last year was, what's happening in your school versus what's happening in the community. Physical distancing shouldn't be a limiting factor about determining in-person instruction as long as masking is present. They do have a good discussion in their full report about the unique risks with athletics, particularly indoor athletics. And so in those settings, they really discuss masking and vaccination as being particularly important. Outdoor athletics did not have as much of a risk. So again, they have a really good discussion in there about that. They talk about standard cleaning being enough, not needing to do deep cleaning. That ventilation is important. It's much more important if you have an unmasked school environment. It's not the end all be all, but if you have an unmasked environment, good ventilation becomes even more important. Keeping sick kids out of school and sick teachers and getting them tested is very important as well, as number 9. And then just standard practices that you should do, whether COVID's around or not, is just make sure people are educated about hand washing, covering coughs, other hygiene things. And then just having a culture of don't come to work or school if you're sick, don't come back here, no longer contagious. And then just a little bit more about the modified quarantine, because I do know that there's been some schools kind of creating their own modified quarantine, but there have been schools and countries that have successfully done this with masking in place. And some have them have those that have been exposed either continue coming to school or have them continue coming to school if they're testing negative. So they have found that that is safe because with masking and other mitigation measures, transmission is quite low, and so that does appear to be safe. But this ABC Science Collaborative does stress that that's just allowing kids to stay in classrooms, that they should continue to quarantine for the 10 days after the exposure. So they should still follow those recommendations for other extracurricular activities and community activities. So they can keep coming to class, however, they shouldn't be playing in sports or going to Boy Scouts, that kind of a thing is what they're recommending. So this is a table they put together. This is again in their full report. So they have, you know, what's really important when you're fully masked, what's more important if you have a partially masked or unmasked environment. So again, there's not data to support doing a modified quarantine if you have a partially or unmasked environment. Screening testing could be considered if you have an unmasked environment, so you can identify more of the asymptomatic cases, because that's really the big concern with an unmasked environment, is you don't know who's unmasked and spreading things. If community transmission rates do go up, basically the goal here is to keep kids in school. So considering adding in masking prior to shutting down school is the recommendation there. The importance of vaccination becomes highlighted when masks are not in use. Distancing becomes more important, cohorting becomes more important, and we're really working on your ventilation tactics becomes more important. So again, just some good evidence there. Another one that's out there is from the European Union. They looked at all the evidence that they've been compiling over the last year, and that's all reviewed as well. And I just put the link there for you, but pretty much supports all the same things we've been saying. We will share this. This is about almost 60 scientific articles that a few health departments in the state and some healthcare systems have reviewed, discussing the benefit or the efficacy of masks, just so you have it in case you are deciding to go this route and you get challenged. Well, there's no data to support it. Well, now you have a nice data review showing the support. That ABC Science Collaborative also has a really good FAQ, which really discusses the concerns that parents often cite about safety, effect on education and things like that. So those are just some more resources for you. Before we get into the data, it was brought to my attention this week that I probably confused all of you inadvertently. The CDC transmission rate and the MyStart map information, I had not read the fine print well enough. I thought there was just a mathematical difference between the two. You're basically just moving a decimal point. It's actually more than that. The CDC transmission rates are based on the last 7-day case totals per 100,000 population. So they add up all our cases for the last 10 days and then do math to figure out the rate. The MyStart map, they use a 7-day running average. So figure out what our daily average is for the last 7 days. So they're both meant as ways to really take out the day-to-day variation. But when you look at it, the numbers look very much the same, when really you would expect, if it was the way I thought it was, the CDC data should have been down a factor of 1. So I'll show you what I mean here in a second, but I did provide you with some links there. You can see it'll explain more what I'm talking about. But the CDC data here is at the top, and it's 135 per 100,000 at the bottom, 136 per million. And so, wait a minute, this one up top should be 13 if it's just a mathematical thing. So at the top it says weekly cases per 100,000. At the bottom it's daily cases per million. So again, I really apologize for that confusion. I just didn't read all of the fine print on the CDC website about how all their data was presented. So that is the difference there. So speaking of data, we'll just do this. I again encourage you to just go to the mystartmap.info website because these numbers are changing really, really quickly. We will send these out though, and we will post them on our website. But again, it's really difficult to keep up right now. And even just looking at the data, just going a few days forward and a few days back, things have changed a lot. But we no longer have any counties that are in the no masking range. I don't think the state of Michigan has any left. I think the last two finally dropped off. So every county is now in the substantial or high CDC risk category. The percent positivity for our counties are kind of all over the place. I'm trying to see. The daily tests per million are also low. And I will have to admit there were some errors this last week with reporting, and so that might be falsely low. I did go back in and manually fix all the percentages, but I did not check that. So again, I would really just encourage you to check the MyStart map to check the most recent data or the CDC website. If they didn't update and things just kind of glitched on them. So the rest of these slides, other than a couple that I'll note, are all from the state response data and modeling update for this week. So just in summary, the state as a whole is in the high transmission range. Our percent positivity has been increasing for the last 2 months. Our case rates have been increasing for 2 months. We're still in the lower half of the country when it comes to cases. So we're about a month behind most of the country this time around, whereas the last surge, we were one of the leaders. So at least this time we're one of the later ones to the event here. But over the last month, pretty much all the genetic sequencing that's been done is showing Delta variant. So it's basically assumes that just about every case now is a Delta variant from what we know. Our inpatient cases due to COVID are increasing and have been for the last 5 weeks. We have the 7th lowest inpatient bed utilization. Our deaths have been increasing for 3 weeks, and we still are in the lower half of the country for deaths, so that's good. So again, our case rates are going up in a similar way as other states that have had this Delta variant surge, and like I mentioned, we're about a month behind those states. As I'm sure most of you are aware that the states with those other big surges that have had school already start have already had several closures. And we're seeing pediatric cases go up just because, unfortunately they're one of the lower vaccinated age groups. In the last 30 days, those who are not fully vaccinated have contracted COVID at a rate 7 times higher than those who are fully vaccinated, and have a death rate 30 times that of those that are fully vaccinated. So we are still seeing very strong vaccine protection against hospitalization. So this is the weekly case rate for our state over the last 6 months or so. Well, 3 months, 2 months. This, I kind of snuck 2 slides on here for one. This is our hospitalization trend, so continuing to increase. The bottom right here, I showed you this last week. The red line is our current hospitalization rate. It goes to this dotted line, and it's just, it's tracking right along with what the wave we had over last winter was. Hopefully we won't peak as high because of natural immunity from prior infections and vaccination rates, but right now it's still tracking along with previous surges. Right now, our 10 to 19-year-olds are the 4th highest case rate. Our 0 to 9-year-olds had a 21% increase in the last week, and the 10 to 19-year-olds had a 12% increase. So those were the 0 to 9 was the biggest increasing age group in the last week. Our young adults are seeing increases. The 30 to 39-year-old, to me as a young adult, had one of the other largest increases. So again, you know, our older vaccinated population is being spared. The Delta variant is basically everywhere. They're not going to report to us individual cases anymore. They're just going to add the information to people's files now, just because, again, it's gotten to be such a normal thing. Just like when we had the Alpha variant in the spring, the counties that still haven't had one confirmed is likely just lack of samples being sent to be tested. So the U.S. as a whole, this gray line is number of millions of doses administered daily in the U.S. That has increased in the U.S. In Michigan, the red line, that's hundreds, or yeah, it's tens of thousands, so 20,000, 40,000. So there's a different scale for each one. Doses given in Michigan daily. So we've stayed flat. So my hunch is, as our surge worsens, hopefully our line will start to go up. I think the rest of the country is going up because of what they're seeing in their states, but our state has not yet really done that. So it's a little disheartening. Pediatric data from the same report I showed you last week. This is their August 19th report. Overall, throughout the pandemic, kids have been 14.5% of all COVID cases, but this past week, they were 22.4% of all cases. The week prior that I reported to you, it was only 18%. So they are contributing more percentile of the cases. In this past 2 weeks compared to the prior 2 weeks, there's been a 7% increase in the accumulated number of kids cases. The number of tests positive for kids and the number of kids being hospitalized has stayed pretty stable from week to week. So this on the top, these are the number of childhood cases of COVID per week. So this far right is this most recent week. On the bottom, the light blue is the adult cases and the dark blue are the pediatric cases. This yellow line are the hospitalizations in people 0 to 17 years of age through the whole pandemic. And again, we're hitting an all-time high, and nearly 50% of them had no pre-existing condition. And finally, this was another slide shared by the state, just a summary of some of the issues some other schools have been having. So I really didn't want to be a gloomy Gus, but that's what I had today. I will try to stop sharing my slide here and go to questions. All right. All right. So the first question, I'm sure, was when I was talking about masking. It says this means masked when the close contact occurs, not after it happened, right? Correct. So I'm assuming that question is about the modified quarantine. Yes, it's masking before, because otherwise the viral loads and things are just too high. The low transmission rate in schools that we know allow it to be safe for kids that have been exposed to come to school, because the transmission rate is so low, is due to masking. We have no evidence whatsoever to show that after exposure, having someone mask and come to school is safe. How accurate is rapid is a positive rapid antigen test when a person has symptoms. For example, if a person has a sore throat and tests positive on rapid antigen test, is this accurate enough to warrant isolation and quarantine? When someone has symptoms and it's positive, it actually is very accurate. It is the accuracy, then the sensitivity and specificity. Your positive predictive value does depend on your pretest probability. And so when someone has symptoms of COVID and they test positive, then you're about 95 to 99% sure they have COVID. The issues are really if they have no symptoms and it's positive, then you worry it could be a false positive, or if they have no symptoms and are positive, or they have symptoms and are negative. So those are the times where with an antigen test, because it is a bit less sensitive, we do worry. So again, if they have symptoms and are positive, you do not need to get a confirmatory test. And there is an algorithm in the Managing Positive COVID Cases and Contact Guide that I sent out a couple weeks ago. I was just trying to remember. That might not be exactly what I named it, but there is an algorithm of how to handle antigen tests in there. Can we see slide 26 on the screen again? Well, we will be sending this out. 26 was the school, was the news release. We'll post it for the sake of time. I'll come back if we have time at the end. How's that sound? For contact tracing is the new protocol if masked within 3 feet and unmasked within 6 feet. Yes. So and then, for 15 minutes or more within a 24-hour period. But yes, that is correct. And that also was explained in that guide that we sent out a couple weeks ago. And there is an algorithm for that too. Any other questions? That'll work on pulling up. So here's slide 26 again. But this was in the weekly report from the state. And again, we'll send these out. I did not look these up myself. I'm just sharing from that report. So. All right, well, I'm going to stop sharing again just because I'm not smart enough to also see my chat. So if anyone's on the phone or doesn't have access to the computer, if you want to unmute yourself and ask, go for it. Otherwise, we will send out the slides and the recording and the data review. And I think that was it for now. But if you have any further questions, just give us a holler.